Thanks, Jenny, and we will try to get through our comments quickly so that we can entertain your questions. I want to thank everyone for joining us. Before we get started, I want to thank our first responders, medical staff, Denver Public Schools, all of our city officials and workers, and Governor Polis and his team who have been working around the clock to address our residents' evolving needs during this time. Come on up here, Richard, if you would. And if there are other culturals in the room, we'll ask you to join us up here if you don't mind. I want to particularly, again, single out Governor Polis. I cannot thank him enough for his leadership for the entire state. His leadership has been clear, transparent, substantive, and strong at a time that we need direction, guidance, and we need good information. And he has been just that. He is not disappointed as I talk to him daily in terms of how we're all addressing this, and he has been a tremendous partner in helping the city of Denver effectively address these challenges as they have befallen us in the city and throughout the nation. I also want to thank all of our residents who have been doing their part to mitigate the risk in contracting the risk of contracting during this time. Our priority is to ensure the health and well-being of our community. And it's important to remember this is a dynamic situation requiring tremendous flexibility and response. Our plans and tactics will change as situations evolve and we have new information and strategies. We remain in close coordination again with local, regional, and state partners. So today, following Governor Polis's guidance from this morning, we will be issuing a public health order to cancel public events at certain venues owned and operated by the city beginning effective immediately for the next 30 days until April 12th to protect the public health and safety and mitigate potential spread of COVID-19. These venues include Red Rocks Amphitheater, including the Visitor Center, the Denver Performing Arts Complex and all of the theaters, the Denver Coliseum, the McNichols Civic Center building, and the Colorado Convention Center. And beginning this Monday, March the 16th, libraries and recreation centers in the city of Denver will be closed until further notice. All other cultural facilities, including the Denver Museum of Nature and Science, Botanic Gardens, and the Denver Zoo will be issuing their own closure protocols. The Denver courts are also currently engaging in prevention and risk mitigation planning with our state and local partners and are committed to making every effort to protect our jurors and the public which we serve while also maintaining business operations to the fullest extent possible. During this evolving public health situation, the health and well-being of everyone in our community, again, is our number one priority. This order follows the state of emergency I declared yesterday for the city and county of Denver in response to COVID-19 virus. The declaration order may make additional emergency resources available to assist Denver's emergency response and gives the city greater flexibility to acquire the needed resources. Now I want to shift to public safety because we have some modifications that will be occurring with regards to our emergency response. I want to thank Chief Payson for being here as well today, who can take additional questions if you have them. The Denver Police Department will also be implementing a modified report-taking process to help prevent the potential spread of COVID-19 virus. DPD will begin taking some reports and statements via phone call instead of dispatching officers to gather information in person. To be clear, this change will not impact the dispatching of officers to high-priority emergency incidents. DPD will encourage our residents to call 911 to report an emergency or 720-913-2000 to report a non-emergency situation. Denver's Emergency Communications Center personnel and DPD personnel will then work together to identify calls where an officer's presence is not required to complete a report. DPD also encourages residents to utilize its online crime reporting tool when possible to help further reduce person-to-person interactions. This tool is an option for reporting crimes such as theft, vandalism, loss of property, identity theft, and more, and can be accessed by visiting www.denvergov.org/police and clicking the Report Crime Now button on the right side of the home page. If our residents want to see a current report of meeting and event postponements, that can be found on the denvergov.org website if they just click on the COVID-19 tab at the top of the page. Again, I want to reiterate, this is an evolving situation, and we are constantly monitoring what is happening so that we can properly reassess our responses and match what we are currently doing in the marketplace. I want to also reiterate, these are not easy decisions, but the welfare of our residents and visitors is at the forefront of our thinking and taking the step to cancel gatherings at these facilities and lessen the possibility, again, of exposure to the virus. And Denver will continue to work closely with our state and our regional and local partners to mitigate the impacts of this public health crisis. Before we open it for questions, I'll share with you that I have also received several phone calls from mayors around the country and actually from Puerto Rico. We have not talked yet, but we will talk in a few moments. And mayors are beginning to share information, best practices on how we are mobilizing and working to respond appropriately to the COVID-19 virus. We'll continue to do that, but I got to tell you that I'm just very proud of how our governor has worked with all of us as mayors, county commissioners, and local elected officials to hit and to meet the challenges of this COVID-19 virus head on. We'll open up for question and answers.
Yesterday, we declared a state of emergency. Today, the governor put a limit on 250 people on single events. Last night, as you know, I'm sure there was a concert at the Pepsi Center with thousands of people. Do you regret not canceling that, even though it was in your power?
You know what? We were continuing to monitor the situation, and as I said yesterday, when I issued a very strong request to discourage gathering of 250 people, that as we evolved this, we were waiting for even more guidance from CDC and even the state at that time. It came either late last night or this morning, which made what we're doing today even more appropriate because it gave us alignment with where we were thinking. Although I wish that guidance would have been sooner, it's here now, and we can make the proper steps to protect folks. Do I regret it? I mean, these are tough calls. I got to tell you, we're thinking about it constantly. They're tough calls. There's a lot going on. Obviously, we want everything to be perfect. Would it have been perfect to cancel it? Probably. Do I regret it? I don't know if I regret it. We're making decisions with the best information we have at the time.
Mr. Mayor, what is the prevention to ensure people experiencing homelessness are tested, and if they fall ill, if they have a place, an isolated place?
Yeah. I'm glad Britta Fisher is here. We'll let Britta come up here and answer that question, but a lot is happening.
Hi, Donna. The question was about how we're serving people experiencing homelessness.
How are you ensuring that they're being tested and that they have a place to rest and recover if they fall ill?
Yep, we have some current rooms that we're putting into service in order to ensure that we can take those individuals who are experiencing homelessness, who are in the testing period, and separate them from population in large shelters. There's also, for those who have not actually been tested but have symptoms, isolating within the shelters so that those with any symptoms are doing that. We're in daily calls with our shelter providers and working with them on the developing guidance that the mayor just expressed.
Do you have numbers on the number of homeless infected, or?
I do not have numbers at this time.
Yeah, is it more than zero?
I'll defer to my colleagues in public health for that.
So the rooms are in the shelters at this point?
No, that isn't. We are looking for off-site locations that we can help to house persons experiencing homelessness.
Hospital?
We are getting those into place.
Mr. Mayor,
We do have motel vouchers currently as well.
the President declared a national state of emergency a short time ago. Can you run down what that frees up you to do additionally, what you weren't able to do before that declaration?
I have read the headline, at least, of his declaration, and what his declaration does is similar to what the governor's declaration does and my declaration does, is to prepare us to access additional resources as necessary. Obviously, those additional resources that we would want to access come from the federal government as well as the state, and so his declaration helps to make that a lot easier for us.
Mr. Mayor, you went down all the city-owned facilities and what will happen there. How will you deal with privately owned venues? Will you be asking, enforcing? How do you deal with their gatherings going forward in what you ask?
In this evolving situation, one of the things that we want to be clear about, the governor has given guidance. We have followed through with the suspension of activities within our facilities, and it is my hope that the private owners and operators and promoters follow the strong lead of the public sector to counsel. Now, I will say this, we are already seeing that the major promoters that do a lot of our events in the city of Denver, throughout the state of Colorado, are beginning to counsel events.
Mr. Mayor, obviously things are moving every single day.
Yep.
You have to look far ahead. Are there any other restrictions that you're currently discussing or looking at?
I mean, we continue to look at a lot of things. There are so many pieces that are constantly moving. Again, we're just going to continue to be under the guise of protecting the public as best we can in every circumstance that we possibly can. I will also share, well, I didn't mention it, but we'll be pulling events that are under the city of Denver that have been permitted in the city of Denver as well, pulling those events and working with those organizers to reschedule their events really soon. Again, the goal is to make sure that we minimize the possibility of coming in contact with the virus.
What's the cutoff date for the cancellation of events in public spaces?
Right now, for these venues, is April the 12th for 30 days. The libraries and the rec center until further notice.
People keep asking us how they can help their neighbors, donations. Is anyone up there, can they talk about how people can help others in need right now?
Yeah, I mean, we are all talking about how we can help the neighbors in need. Listen, during this time, this is where the humanity of all of us rises to the top and to the forefront. And if you know of particularly an older adult on your block, in your building, who may need to access their medication or need to get to the grocery store, just like when it snows and we need to help remove the snow in front of their homes and help them move about, this is the time to say, what can I do for you? Unsolicited. What can I do? Do you need something from the grocery store? Can I go grab your medication for you? Can we make sure you have enough food to sustain you during this time? We need to protect our older adults in particular who are most vulnerable and susceptible to this virus. And then, of course, if you're home during the day as parents are trying to figure out what to do with their small children while schools are shutting down, whatever help you can provide in terms of saying, maybe I'll care for your children while you go back to work. And let me encourage folks, we are closing these venues because of the risk of concentrated groups coming together and being in one place in excess of 250 people. We want to encourage folks to be active in the city of Denver. This is not the time to shut down. This has the potential of being very impactful to this city, particularly economically. And if you can still get to restaurants then where we already practice social distancing, we want to encourage you to do that. There are workers in those restaurants. There are bartenders who depend on our ability to go in and be patrons. And so let's do what we can to continue to contribute while also practicing good hygiene and washing our hands and keeping social distance and being mindful that we're still under a very serious threat to this virus.
I know a lot of employers are trying to figure out how to maintain minimal staff and taking care of their own staff. And what, in general, would you advise them? And what are you doing for city and county employees? Yeah,
I was just asked that question. Let me see if I have a proper. Maybe it's just me that's going to do this. We are doing a couple of things, actually. First, for what we're doing at City and County of Denver, we have done the assessment, the appropriate assessment, determine our essential, non-essential employees, and those that could possibly work remotely. And we have now set up the process where department leaders and supervisors can begin the process of allowing their employees to work remotely, those that have the capacity to do so. Secondly, we are also taking a look at our HR policies and procedures to make sure we have flexibility where we do not hurt our employees and their ability to take home pay to care for their families. So if they are sick, if they are suspected that they may be sick, how do you allow them to use their PTO, but also help them if they don't have PTO? Those are the things that we're beginning to move on very quickly. I want to make sure if there's anything else, I'm looking at some of our department leaders, or anything else to lay out there. But the key is to make sure that we continue with our continuity of operations as a city, while at the same time giving our city employees the ability to work remotely. Again, hopefully we lessen the possibility of coming in contact with the virus. Now, I have been asked about that from the private sector, and let me tell you what I told a private sector leader. If I was leading a private sector company, this would be not the time for me to be wedded to my HR book. This is the time for me to show compassion and empathy to my employees and to do what's necessary while trying to keep my business running, but do what's necessary to help my employees to help meet this challenge of protecting themselves and their loved ones. And in that, they say we're going to be watching what the city does. We have set up remote. We have taken a look at our PTO, and we're trying to identify every opportunity to be flexible with our city employees.
Out at the airport, have you issued any more guidance for travelers, or is the airport conducting any more screenings for people coming into the state?
The city of Denver, the airport is still not under the screening of the federal government as other airports have. But we continue to monitor Denver National Airport, the orders that are coming from the federal government, the president, and the FAA, as well as maintaining the contact and conversation with our airlines, which, as you know, are a critical partner with us at the airport. Let me remind everyone, this is the 5th busiest airport in the country. And so Denver National Airport, Chicago, O'Hare, LAX, Dallas, Fort Worth, these will be airports that if for whatever reason we modified anything going on at those airports will create a major jam across the nation. And so we are mindful of the role that we play in this airline industry while at the same time keeping everyone safe. That's why we're doing the things with sanitation, hand sanitizers, as well as sanitizing wipes for people who are going in and off these planes. Any other questions?
Sure.
Sure.
There's been a little concern about inside the jail. How are you handling things inside the jail? Are you fully staffed?
We are.
People wanting to
We are fully staffed at this time, so we're very fortunate for that. We have nobody that's tested positive. We actually have not even had to test any of the inmates. There's no concerns at this time. We're developing new processes and procedures. We expect at some time there will be some changes, so we're definitely working on planning, but we don't have any just yet.
Can you run down what facilities you have? You have one here, one out there.
In the hospital. So,
Diagnostic center.
correct.
Very good.
Thank you.
Mayor, will there be any changes to the public access to city council meetings or other city government events?
I don't think so. I think outside of mandatory hearings, legal hearings, we don't expect. I'm looking at Sky. I don't expect that there will be any changes to city council operations. We're staying in contact with Council President Jolyn Clark.
Mr. McDonald, if we could really quickly, is the focus still on testing? We've heard from some state leaders and epidemiologists who say it's too late for testing. Is your focus at the Denver Department of Public Health, is it still on testing, or is it on containment and social distancing?
It's on all of those. The more we know, the more we can test, the more we can make educated decisions on how we handle people who are ill, not knowing whether they've been exposed to COVID or not. I know that the mayor's been in close contact with the governor to expand on the city's testing capabilities with our partners in the medical community, but our focus is on everything that'll get this under control and flatten that curve of people that are going to see our medical care providers. That's key with this.
Mr. Mayor, we just have some people concerned about closure of Red Rocks and what that actually is going to look like. Can you kind of provide some details of that?
Yeah, well, I'll ask Ginger White to come up here, who is our Executive Director of Arts and Venues. Any thoughts on that?
Yeah, sure. So we too are managing the situation as well, and it's a dynamic one, as you know. One of the things that we know is right now our Red Rock season doesn't open until April 16th. So fortunately, at this moment, those shows are still planned to go on. The sunrise service that was scheduled for April 12th has already been canceled. Otherwise, our visitor center will be closed, and we will just encourage people to enjoy the park if they can, and through that six foot limit. But certainly, we are not going to be having our visitor center and other amenities open right now.
You're not barring the public from going to the park?
No, not at this time. No.
Ginger, this question is just for clarification. The mayor was asked about the Pepsi Center. You can clarify that we don't control the Pepsi Center.
That is correct. Arts and Venues in the city does not control the Pepsi Center.
Yeah, let me just add that a lot of these conversations with regards to our culturals has occurred over the last 48 hours. I mean, we've been in close contact with them, discussing the programs, the performances, the events that were to take place. And so, again, these are not easy decisions. This is the life of our city, and but for this very unique situation that is, quite frankly, a threat to all of us and to the public, and our priority keeping everyone health and safe, we will be moving forward. But this is the right call, and we're grateful for the partnership of our culturals and other venues who have stepped up and said it's the right thing for us to be doing.
Colorado saw its first death from COVID-19. I know that you've been talking to hospital leaders, I'm sure, around the city. Do you feel like Denver is prepared in the hospitals that we have here for the rush that we may see?
I know that, and I'll ask Bob to come up here, but I know the governor has also been in communication with the medical community, and working to prepare for that rush is something that they've been working on for quite some time. We're all greatly concerned about it. Our condolences go out to the family of the individual who has deceased recently. This is a tough situation, but absolutely, I know they're going to do everything they can to serve those individuals who are going to come into their facilities for services and for testing and for treatment. Anything else? Yes.
Sorry,
Jen.
I'm going to have to break us up. We need to get the mayor to his next meeting and the rest of our folks back to the Emergency Operations Center. But just a reminder that we are holding Monday press conferences every week until we're in a more stabilized place in terms of information. So you guys will can expect a media advisory coming out on that with the timing. It'll be back in this location on Monday. We're just confirming the time.